Hi, this is Assemblywoman Petrie-Norris. I've been getting a lot of questions about COVID-19 testing, and I want to take a few minutes to answer some of those today. Question number one, why aren't we doing more testing? Why aren't we doing large-scale testing like they did in South Korea? And the answer is very simply that we do not have sufficient capacity. We don't have enough tests here in California or all across the country. There's a critical shortfall in testing kits, in testing swabs, and in testing reagent. We are moving heaven and earth to close that gap, but we know that we're still going to confront a critical shortfall. Second question, my doctor thinks I have COVID-19. I've got all the symptoms. He's still not testing me. Why? And there's two reasons for that. Number one, we talked about there's a critical shortage of testing supplies. So we're only testing individuals who are at high risk or having severe symptoms. But number two, in addition to the shortfall in testing supplies, we are facing a critical shortfall in the capacity of our healthcare system. We are working incredibly hard in the state of California to build surge capacity for a surge we're expecting in the next 6 to 8 weeks in order to meet the needs and to fill this critical shortfall. But once again, despite these Herculean efforts, we do not have enough hospital beds. We do not have enough doctors and nurses. We do not have enough personal protective equipment. And because of that, we can only test and treat the patients with COVID-19 who are either in a high-risk group or experiencing severe symptoms who may be hospitalized. Because every single minute that a doctor or nurse spends doing a COVID test on a patient with minor symptoms is a minute they don't have to spend treating a patient with critical needs. And every single face mask and every pair of gloves that gets used in a non-critical COVID-19 test is a pair of gloves and a face mask we don't have in an ICU. So we're urging people to contact your medical provider, but to understand that if you have minor symptoms and you are not in a high-risk group, most likely you will not be tested for COVID-19. And then the last question. So if we are limiting our testing to such a degree, doesn't that mean that the real number of cases is a lot higher than the official count? The answer to that is yes. Our healthcare experts estimate that the real number of COVID-19 infections is many times higher than the confirmed count of cases that are being reported here in Orange County and across the state. And I share that because I want to make sure that people are not lulled into a false sense of security when we see numbers that seem low. The risk is high, the threat is very real. And that is why we are asking all Californians, please stay home, stay safe, and stay strong.